안녕하십니까. 1% 한의사 김채연입니다.
Hi, I am Dr. Mommy Mintz-Mahorn, U.S. licensed naturopathic doctor and advanced clinical hypnotherapist.
네, 오늘은 강의에서 불가피한 이유로 보여드리지 못한 네뷸라이저 시연을 보여드리도록 하겠습니다. 먼저 네뷸라이저 기계를 살펴보겠습니다. 이거는 먼저 미국에서 온 네뷸라이저입니다. Could you explain your nebulizer?
Yeah, so this is a compressor nebulizer similar to the one that we have here from Korea. And essentially what we're going to do is we're going to take the tubing, we're going to connect it to the bottom here, and then with whichever one we use, we would just plug it in, and then we'll do the same for the other one. And then once we are started, we'll just turn it off.
Wow,
Really simple.
I see. 그리고 다음은 한국에서 구한 네뷸라이저입니다. 똑같이 기계가 있고 마스크가 같이 들어있습니다. 구조나 기능은 거의 흡사합니다. 강의 때 말씀드렸던 NAC 용액을 오늘 실습에 한번 사용해 보도록 하겠습니다. NAC는 글루타치온 전고체라고 설명드렸었는데요. Could you explain a bit more about NAC?
Yes, of course. So NAC is short for N-acetylcysteine. Cysteine is an amino acid that is found within our bodies and utilized, and it is the precursor for glutathione. It's also an antioxidant similar to glutathione. So when we're using it for nebulizing and even orally, we're using it for the antioxidant effects, but we're also using it because it's a mucolytic, so it breaks down the disulfide bonds within mucus, which makes it less viscous and easier for people to pass it through and expectorate.
Mm-hmm. Thank you for the clear, detailed explanation. Then we will start the demo. For reference, I have chronic rhinitis. Would nebulizer therapy help with that?
Yeah, so chronic rhinitis is one of the indications.
Mm-hmm.
We also use it for COPD, chronic obstructive pulmonary disease, asthma, bronchitis, and even long COVID and sinusitis. So it should be able to help support chronic rhinitis, and we'll see how it helps you at the end.
Okay, awesome.
So now we'll start the demonstration. So I'm just going to have you put the mask on.
Mm-hmm.
You're just going to put it behind your head, and then you're going to breathe into the mask. You just have to uncrumple it a little bit just because this is your mask and you're going to touch it.
Okay.
Mm-hmm.
This.
Oops. And if we need to make it, we can adjust at the nose bridge. And if you need it tighter, you just pull at the strings.
Ah. Uh-huh. Got it.
Okay, now we're going to turn it on so it is a bit loud, okay?
Okay.
And just breathe normally through your nose, and then you can alternate with breathing through your mouth. And then if you have to cough, it's okay. Coughing is normal if you have to cough, okay?
Okay.
And then through your mouth, nose and mouth. Yeah, it does cause coughing, which is, you would have that also with glutathione because it causes the bronchospasm.
Okay.
Okay. So how was it?
Something goes through my nose.
Mm-hmm.
And my nose inside a little bit itchy.
Mm-hmm.
But I can definitely breathe more comfortably.
Good.
Mm-hmm.
And did you notice any mucus going back and down?
Yes.
Yes.
It's going back through my nose.
Yeah. And does it feel really thick or not as thick?
Quite thick.
Okay. Yeah. So, but before it was just stuck in there. It wasn't moving before you did the treatment. It wasn't moving you weren't having any movement of the mucus. It was just blocked, right?
Mm-hmm.
So you notice that the effects are pretty immediate. So when we're seeing this treatment, like you experience, you can see things moving immediately because it is going to break down that mucus. So we notice that immediately. And we can see the effects last because it's going directly into the lungs. So you'll see changes. You may notice changes over the next few days. And if you notice like you're sniffling a lot, just blow your nose and let the mucus come out. Because that's the goal. We're breaking out the mucus so that it can easily come out.
Wow, awesome.
Yeah.
So, do the effect appears immediately?
Yeah. So as we just demonstrated, you're noticing that you can breathe easier. And it's only been maybe 10 minutes since we tried the therapy or since we began the therapy. So within 10 minutes already, you're noticing that we're breaking down the mucus from the initial, and you did have a lot of coughing, so
Yeah.
that's part of the process with the irritation because you are breathing in something.
Oh, actually, I was surprised by my coughing, but do you usually do it for 10 minutes?
Yeah, so we can do it. So we do it as long as the solution is there. So we like everything, there's a certain amount of the solution that we use, and for 7 to 10 minutes, we'll have the patient breathing in the nebulized treatment until the solution's done. And there's a change in the machine, so you'll hear it like not sound normal. It starts to just go, and then you may hear like a little bit of the fluid movement, and that's when we stop the treatment.
Wow, so interesting. Actually, in Korea, nebulizing therapy usually used in the pediatrics. So, how is their use approached by Andis?
Yeah, so in the US, we do use nebulizing treatments for both pediatrics and adults. As I shared, we talked about glutathione, but also NAC is beneficial for COPD, long COVID, and then even adult like bronchitis. So we see a lot of these conditions in adults more than we'll see in children, but we do use it for like asthma in children as well, and cough and things like that, or acute infections.
Awesome. I see. So, 이 네블라이징 기계는 설치도 간편하고 쓰기도 쉬워서 아마 가정집에서든 아니면은 한의원에서 환자에게 적용하기도 굉장히 좋아 보입니다. 오늘 네블라이저 시연은 여기까지 하도록 하겠습니다. Thank you for Dr. Hon.
You are welcome.
Okay, bye.